Congratulations, you've completed Module 1. In this module, we stepped back from today's headlines and frustrations to understand how health insurance in America was built, one decision at a time. Before moving forward, let's briefly connect the dots. We started by reframing health insurance not as healthcare itself, but as a financial system that shapes access, cost, and decision-making. We looked at how care was managed before insurance existed, how communities shared risk through mutual aid, why hospitals needed predictable payment, how prepayment evolved into standardized insurance, why World War II tied coverage to employment, and why Medicare and Medicaid were created to fill the gaps. Each step solved a real problem, and each step added a new layer. Here's the most important pattern to recognize. The U.S. healthcare system wasn't designed all at once. It evolved in response to specific pressures: cost, access, and stability. Rather than replacing old systems, new solutions were layered on top of them. That layering explains much of today's complexity. Understanding this history gives you something powerful: context. It helps explain why coverage feels tied to jobs, why navigating insurance is complicated, why reforms are difficult, and why frustration is common, even among people who are insured. This isn't about blame. It's about understanding structure. In the next module, we'll look at what happened when rising costs forced the system to focus on cost control, and how managed care changed the experience of healthcare for patients and providers alike. You're now prepared to move forward with clarity instead of confusion.